Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing, a whistling sound when you breathe out, and shortness of breath. Asthma and chronic obstructive pulmonary disease guidelines increasingly rely on pharmacological management with inhaled drugs. Inhalers are the cornerstone treatment for asthma and chronic obstructive pulmonary disease and are designed to deposit inhaled drug directly to the lungs with minimal systemic side effects. Press and breathe metered dose inhalers and dry powder inhalers are the most commonly used delivery devices for administering drugs. Effective use of these inhalers requires proper inhalation techniques. However, the efficacy of treatment and therapeutic outcomes are dependent on a patient's adherence to their dosing regimen and their ability to use their device correctly. Inhaler misuse has been observed to be common shortly after their introduction into clinical practice and associated with poor clinical outcomes, such as reduced bronchodilation and decreased disease control in asthmatics. Various studies were conducted on inhaler-dependent individuals and most of them concluded the same result, which is mishandling of inhalers. I consider that healthcare providers, including nurses, build a strong relationship with their patients through effective communication, answering questions, and supporting effective disease management. As frontline providers of patient care in asthma, nurses are often responsible for the ongoing evaluation of asthma control and for deciding the best treatment in collaboration with the patient and physician. A patient's inhaler technique should be closely monitored, as bad habits and poor technique can accumulate over time, making it imperative that technique is reviewed and adjusted at every visit if needed. But unfortunately, the high incidence of incorrect inhaler technique has remained at a similar level over the past 40 years despite advances in inhaler development and education. It is important that nurses understand and adapt to the reasons behind a patient's non-adherence to treatment and the key barriers that can impact on inhaler suitability or technique. For effective management of asthma and chronic obstructive pulmonary disease, care must be taken in matching each individual patient to the correct medication. The three vital components in this decision, that is, patient, medication, and device, form a triangle, and it is crucial that all three interconnect and complement each other. Each patient should be given optimal education to be competent in using their device correctly to maximize efficacy and be happy to use their device. It was found out that nurse-led inhaler education to the patient or their caregiver can positively impact on the crucial technique aspect of the decision triangle. Nurse-led patient assessment and inhaler education are associated with improved technique, compliance, and patient confidence in asthma, and these effects can be sustained long-term. However, there are various barriers present which prevent from implication of this change. For example, age, language, and health literacy level are some of the barriers that may prevent an individual from understanding and following what is taught. In the essay that I submitted, I have suggested a possible practice change that can be brought into effect in our healthcare system to eradicate these mishandling and possible barriers that might hinder the execution of this practice change. In addition, I have also included possible ways to overcome these barriers present.